Right. Good morning and good evening. We'll get started as folks are trickling in. And today I'm especially delighted to welcome to close the Reimagine series, Manish Bhardwaj, who's a James Wei Visiting Professor at Princeton, teaching idealism and entrepreneurship, and also a fellow at the Dalai Lama Center for Ethics at MIT. He will be speaking with us today based on his own learning and experiences on moral clarity and the work of social justice. So without further ado, Manish, happy to have you. Folks, if you have questions and comments, just put them in the chat and we'll try to get to it towards the end of the talk.
Great. Thank you, Tenzin. It's an absolute delight and a joy to participate in the series. So very quickly, my journey doing the work of justice started in 2007 when we started a student group to address the challenge of tuberculosis. And after my PhD, I moved to India to start a TB treatment program, which is now 11 years old. And we expanded it to a maternal and healthcare program, and then a maternal mental health program. And I'm going to be drawing on my experience living, I was there for 3 years, living among those who I was serving. And that's really the talk today is about what I learned, and hopefully going beyond that to illustrate, some foundational principles. So if you do the work of justice, you first need to know what the nature of a just world. What is it that you want to usher in? How should the world be? And you also need to understand the world as it is. You will need tools in the pursuit of justice, technology, innovation, design, creativity, but you need to know how to wield them. Or in other words, the pursuit of justice itself must be just. We'll explore that in some detail. You need to understand the nature of injustice. It's a very different project, constructing a just world from scratch versus dismantling existing injustice. And we won't talk about it today, but you need to understand the history, both of injustice and of justice. And to me, moral clarity is grasping all of these things. Let me start with a story. You see, this is an encounter we had in our maternal and neonatal health program. You see here Rekha with her mother. We first encountered Rekha in our TB program as a teenager, where we treated her. We got to her late, and by the time we treated her, she had a punctured lung. We encountered her again after a few years, this time in our maternal and neonatal health program, when she was pregnant, barely out of teenage. And when we encountered her, she weighed 50 pounds. And as we got to know what had happened, this was her third pregnancy, and her infants in her prior pregnancies had not survived. So when you have these encounters, we are now, a team of over 100, you're in the field, you have this encounter, and the question is, what is it that you're going to tell Rekha and her mother? Her husband is, a migrant worker. Will you promise her that if she cannot afford to get to the hospital when she goes into labor, that you will transport her? Will you promise her that if, the local public facility cannot do any operative procedures, so will you admit her to a private clinic or take her to a tertiary facility? If her infant needs a neonatal ICU, will you make, the 3-4 hour journey with her there? So, these are obviously uh, deeply freighted moral questions, but these are also very practical questions that you need to answer. And it is this understanding of what you ought to do for Rekha, what you can do, and how you reconcile those. I think that's really what's central when I have moral clarity in mind. And how you and what you tell Rekha, what you tell patients, what you tell people who have been wronged, or sort of, we have two strains in us. There's the realist in us, uh, who privileges the world as it is over what it ought to be, uh, and who believes that there's something special about this state of the world we live in, uh, and even if we pursue justice, we ought to obey the constraints that this world imposes as we understand them. Uh, the idealist privileges a world that does not exist, the ideal world, the world as it ought to be, and doesn't believe that there is something inherently special about this world. It's a consequence of choices we made, and we can make different choices. And because an idealist has to chart a course from the as it is to as it ought to be, contrary to sort of the layperson's understanding, the idealist has to understand the as it is to a deeper degree uh, than a realist. Uh, so your worldview matters, or as Susan Neiman, the philosopher, would say, your metaphysics matters. Your deep beliefs that you're not aware of the nature of the world, uh, make have very concrete implementations when you do this work. So let me start with what the world ought to be. What is the nature of a just world? And I'm going to draw uh, from Kant, from his groundwork of the metaphysics of morals, not so much as a technical exposition, but rather than make this talk a compendium of do's and don'ts, we hopefully can draw on Kant's wisdom to illuminate the deeper principles. And so, let's just settle. Morality is just what you ought to do, not what you can do today or in a month or in 50 years. And it's really keeping the ought and the can separate. That is really the central pillar of moral clarity. Uh, I think we are increasingly hesitant to use moral language or the language of justice. And this is to our own peril. I think we are hesitant to use it because we think, there's some kind that it's uh, it's sanctimonious, or it's self-righteous, or it requires following a faith tradition. But Kant's argument was that if you're reasonable and rational, then you know what you ought to do. The difficulty is in doing it. And I think there is broad consensus with all the polarization and divisions. There is a broad consensus uh, on what we ought to do. How we ought to do it is uh, where we disagree. So let me start with the most sort of, perhaps the most celebrated line in all of moral philosophy, Western moral philosophy. Uh, it is impossible to think of anything at all in this world, or indeed even beyond it. Uh, Here, Kant is alluding to even the gods have a moral law that could be taken to be good without limitation, except a good will. The emphasis is Kant's. So, here Kant rejects the old notions of what it is to lead a good life, the cultivation of virtue or the pursuit of happiness. And his argument is virtue can be used to evil ends, and your happiness could be built on suffering or could be apathetic. And so these things are good, but only under certain conditions. And so the question is, what is unconditionally good? And, sort of paraphrasing and roughly speaking, acting from just principles is unconditionally good. And if you're doing the work of justice sort of broadly, uh, it's a statement about ends, means, and motivations. So the pursuit of universal ends rather than personal ends in a just manner. It's very important that the pursuit itself be just, and we'll see what that means. And for the only reason that it is the right thing to do. So free from external constraints. Uh, and of course, we have to pursue personal ends. But the constraint on us in those pursuits is that we consider the demands we make on others, and those others sort of authorize us morally to make the demands. Why is this important? It's how organizations understand their mission. So I can understand Innovators in Health's mission as sort of service delivery and measure it by how many people we reach and what the cure rates are. Or I can understand Innovators in Health's mission as making the world more just. And when it is understood that way, it imposes a whole set of new constraints. For instance, it imposes the constraint that we be just internally, that it matters how we treat, quote unquote, the least among us, not in moral word, but the people who drive us, who clean our offices, who cook for us. Because if we are not just to them, if they do not have a voice, then it is unlikely, or it would be at least unseemly for us. It would be unlikely that we are just to our patients. It imposes other constraints. It imposes the constraint that we be alert because we operate in a patriarchal context. For instance, we be alert to our own misogyny. Otherwise, our treatment programs will treat men and women differentially. And what started out as a pursuit for justice will perpetuate injustice. So understanding your mission and understanding, most universities and colleges do not believe, and I mean, it's written out, their mission to be to make the world more just. The phrases are more around excellence. The department wants to be, the best at something, and Kant would say excellence to what end and at what cost. So this is sort of the notion of a goodwill. The next thing I want to talk about is the nature of moral obligation, right? And the two things sort of interrelated are the view that it's really the animating principle that determines a moral worth. If you're dispensing correct change, as Kant says, because otherwise you would lose customers, that action has no moral worth. If you speak the truth because it gets you something, then there is no moral worth in speaking the truth. And the only motivation to Kant, which has moral worth, is doing the right thing because it is right to do. You cannot predicate moral obligation, and we'll see examples. And in my experience, moral authority, which is all you have when you do this work, because you have no executive authority over public institutions or other stakeholders, the source of moral authority is deeply, deeply seated in how the community perceives your motivations to be. And let me give you an example. So recently, folks who have worked in the anti-hunger community have known that SNAP benefits, or what colloquially are called food stamps, run out in about a couple of weeks. And so recently there was a rulemaking change by the Biden administration. And this is what the the agriculture secretary, the Department of Agriculture, secretary said about why they did it. And I'll let you read it. We may have a constitution and a declaration of independence, but if we had 42 million Americans who were going hungry, really hungry, they wouldn't be happy, and there would be political instability, right? So try and think of that understanding of moral obligation. We should not let folks go hungry uh, because there might be political instability, right? Uh, and so the question is, if you were sure that there wouldn't be political instability, or if you can manage political instability, it seems like that your obligation would get vacated, right? And this is the problem with any sort of predication of obligation. And what the secretary should have just said is no one should go to bed hungry, period. Uh, and that's an unpredicated understanding of obligation. And that's the only one that you cannot vacate. And I'll give you a further example. So, this doing good is good for the do-gooder. Uh, if that's your understanding of moral obligation, then the problem with these things is they're statistical. And for a whole sort of folks, doing good might not do them good. But that doesn't vacate their moral obligation, right? So utilitarian understanding of moral obligation is to have no moral obligation at all. So, to Kant, acting only out of compassion uh, had no moral worth, and he's widely misunderstood on this point. And the compassion I'm talking about is not the compassion of a Buddha, of a realized being. I'm talking about, you know, the compassion of, fallible beings, right? Uh, and if your understanding of moral obligation is no one should go to bed hungry because, this is something I just can't bear. The problem with this predication, with this because is, uh, are several, but the most obvious one is, what if you can, right? What happens the day your compassion runs out? Does that then vacate your moral obligation? I mean, we do this, right? We sort of outsource our moral obligations. Hey, if, I it's great that you're doing this work. I wish I were that compassionate and I could do this work. But moral obligation is not sort of circumscribed in that way. Uh, and so I hope I've given you a sense of why, uh, you do, we are fallible beings. We come to this work with a whole variety of motivations, some noble and some egocentric, but the clarification of obligation is sort of central. And when I started this work for about a year or so, I could see that the community and every stakeholder had one question in their mind: why is he doing this? Why are they doing this? Are they doing it for attention, for money, for fame, to find meaning? And how your stakeholders and your community understands and answers that question really determines the headway you'll make. And one way, which I came to without meaning to, is doing the most menial thing you can do, is a part to self-abnegation and for clarifying sort of your motivation. So when we started the program, the diagnosis of tuberculosis depends on collecting high quality phlegm. Yes, I just used the phrase high quality for sputum. And we were worried that we weren't getting those samples. And so every Saturday morning I used to go out with a group and go to patients and use all these techniques so that we could get good phlegm from them, right? And then it's impossible to know someone's motivations, but uh, I think to a lot of folks it signaled, uh, that at least part of the motivation was, uh, you know, to do the right thing because it was right. And this was important because we had a lot of persuading to do, right? We had to persuade physicians as non-physicians, as outsiders, to change their diagnostic practices. We had to convince lab technicians to not throw samples away. We had to convince treatment supervisors to allow us to do home delivery of drugs, which was, in some ways a contravention, right, of what they understood to be protocol. And uh, the when you make these demands of others, and there is nothing, and it's far easier for them to not do it. There are almost no costs to them for not doing it, and there is a cost for doing it. How they understand your motivations and your moral obligations and what you're doing, uh, you know, uh, deeply affects whether you're going to make that headway or not. So I want to now move to sort of addressing head on the nature of a just world. Uh, and in a nutshell, this is what, we just saw the problem with predicating moral obligations. And so really the only obligation you cannot vacate is an obligation which is unpredicated, or what Kant called a categorical imperative, as opposed to a hypothetical imperative. And so there were three formulations of a categorical imperative. And Kant's project wasn't to tell us right from wrong. He believed that we know, as rational, reasonable people, right from wrong. It was to illuminate the nature of right and wrong. And so I'm going to go through the three formulations, the three ways of looking at a moral obligation or the categorical imperative. And the first is the formula of universal law. And it says that a precept is moral if you can universalize it. And what that means is you have to imagine a world where everyone acts from that precept. Uh, and crucially, you cannot pick your position in that world. You don't know if you're Bezos or if you're, the person working in a warehouse. That's important. And you imagine this world where everyone acts from this precept, and you ask yourself a series of questions. Can this world exist? Is there an inherent contradiction in that precept? Would you want to live in this world? And would you want to act from that precept when you live in this world, right? Uh, and precepts that pass this sort of test are moral. And the idea is not some kind of mechanistic test of what is moral or not. Uh, sort of the and the idea is also not do unto others what you want to be, I guess, done to you. The idea is that when you undertake this exercise of universalizing a precept, it doesn't lead to one set of rules for everyone. It says that for any position that a person finds themselves in, under any circumstance, the precept must be affirming, humanity affirming, otherwise it doesn't stand. So for instance, uh, this leads to the notion of a preferential option for the poor. We do not ask our patients to go to a shop and buy their drugs. We try to minimize their visits to clinics because we believe that they are already burdened, and so we go to their homes, right? Uh, Universalization takes away your egocentric understanding of obligation. Rather, it forces you to think about sort of every circumstance, and it forces you to think about what is affirming in every circumstance, right? The second way to see if a precept is moral is to ask yourself if it is humanity affirming, or Kant's sort of, I think, precise words were that humanity in your person or in others is never to be treated as means but only as ends. This is sort of the most, I think, this is sort of the foundation of human rights and uh, the most popular formulation. And the implication is, and this is a direct rejection of any sort of utilitarianism, uh, you must fully affirm the humanity of everyone, right? uh, and it also allows you to understand injustice as any diminishment, uh, not just of our person, but of our inner life, right? And it's very hard to be unjust when you fully grasp someone's inner life. And one implication of this for us was when we started doing our work, uh, you know, we worked with female community health workers whom we found, these are government female community health workers, and we found this cadre to be completely demotivated. They were not adequately trained, they were not adequately paid, they were not adequately recognized for their work. They sort of got all the blame. And of course, this is in a patriarchal context, right? So there's this clear misogyny. And instead of a transactional relationship, you train them, you monitor them, and you pay them. uh, Even before we advocated for patients, we advocated uh, for ASHA workers, as they're called, right? And we saw, what they were getting paid for TV work was so low that we argued that their wages should be tripled. Uh, we saw they were spending hours walking, and so we started, training them to ride bicycles. When we asked them for what they aspired to be, we started uh, tutoring them to take nursing exams. And several of those things had nothing to do with TB, but it is impossible to do the work of justice if you do not fully affirm the humanity of everyone who is involved with your work, right? Uh, and then the final sort of formulation is that of universal legislation, which is a precept is moral only if it was framed by having everyone that you make demands of at the table participating with an equal voice as, rational, reasonable, uh, acting from freedom, and being transparent. And sort of one implication of this is, what right did I have to move to this community and to make demands of patients? Because when you do this work, you make demands of patients. You ask them to come to hospital. Sometimes that costs them their day's wages. Sometimes you fail them. And so the question is, what gives anyone the authority, often on a whim, to move somewhere and to do this work? And uh, that raises the bigger issue of, should we ever privatize the functions of justice? I mean, what's the moral basis for anyone except, uh, uh, democratically elected government that fully enfranchises everyone? Aside, so clearly there is moral authority there, but as unelected representatives, I mean, where do you draw your authority from? And the formula, or the notion of universal legislation, uh, you know uh, tells you that if you move into a community, you have to get morally authorized first, which means the community has to have a say in your work, has to permit you to do your work, has to participate in your rulemaking and procedures, and you have to be transparent and accountable, almost none of which generally happens in development. As a nonprofit, your accountability is almost always just to your donors, or per- perhaps uh, some government bodies, but there's no Freedom of Information Act to or any requirements of transparency, and that can cause a lot of damage, and that does cause damage, because if you're not internally just, then you perpetuate that injustice. So it's uh, when you understand your moral obligation, this understanding it as, can you universalize it? Is it fully affirming? And does it get everyone at the table to participate? Uh, you know, these are sort of central to how you do your work. I'm going to go fairly quickly through the nature of injustice, just because if you do this work, you have to recognize which prong of injustice you're combating. And, broadly, injustice is any affront to human dignity, but you can also define it sort of instrumentally, very instrumentally, I would say, as denying access to a resource to a group, right? And that would cover, uh, aspects of racism, of the patriarchy, of any sort of discriminatory hierarchy. But with more thought, it also covers the problems of polarization and climate change and so on. And the point of this instrumental definition is that injustice often, not always, has compelling material advantages, and that's why it's hard to knock off. And if you understand injustice as denial, denial uh, of a resource to a group, then it becomes clear how you undertake the project of injustice. Kant gave us a theory of justice, but did not give us a theory of injustice. Uh, so, it requires group formation. It requires some kind of justification for denial, and then you actually have to deny. And that's why I teach my students to be very alert to group declarations, right? And I heard a lot of them when we started this work. Patients are unaware, it's their own fault. Physicians are corrupt, all bureaucrats are corrupt, and so just a lot of blanket statements. And what is essential to the project, to this step of grouping, uh, you know, in sort of discriminatory hierarchies is segregation, right? Is erasure. Like the biggest threat to injustice is if um, if two groups actually sit down and uh, you know understand members of the other group, if humanize members of the other group, that sort of is the biggest threat to injustice. And so segregation is an important part, and erasure is an important part. There was a time when, as sociologists say, custodians were invited to holiday parties. Today, they're not. And if they are, the discomfort in those encounters will reveal how little, our lives have with their lives while we sort of inhabit the same country. So, and then the justificatory project of injustice is essentially to stereotype and assign inferior traits, and the denial is often covert. Sometimes it's starts with being overt and then goes covert, and then there's also expulsion. If someone does get access to a resource, then the project shifts to expulsion. And the reason I'm going through this is if you are working for justice, then you have to identify sort of which prong of this you're fighting sort of against. I will just sort of illuminate an aspect of injustice, which should at this point be more a conjecture than law. But when you work in this space, it's important to realize that every advance and every calamity increases injustice unless you sort of universally legislate. And I'll give you an example. When, in the early sort of days of the pandemic, folks who do the work of justice would have predicted tragically that the pandemic would disproportionately affect the marginalized, right? So folks of color, the poor, women, and that is tragically how it came to pass. And the lesson is, when these things are so predictable, you have to sort of proactively design policies to prevent this. And then it's not just calamities which exacerbate injustice, it's also advances, strangely, that or maybe not strangely, exacerbate injustice. So when vaccines came out, it was again predictable that the communities that needed it most, or nations that perhaps were the most vulnerable, would also uh, be last in the line. And so, when folks ask, what can technology do? What can innovation do? By itself, uh, the default nature of how this works is advances increase injustice unless you manage them through universal legislation. Uh, I won't go. Uh, so, with regard to how we approach uh, the work of justice today, I just want to uh, sort of mention the the what the zeitgeist is, and some of the issues with it, right? So what we value in development, in, I can say, in international development, it's we the dominant strain, or is a strain of utilitarianism, right? We value newness, not innovation necessarily, but newness, right? uh, we value scale. We privilege scale above all else. Uh, and once you privilege scale, then you privilege what we call cost effectiveness, sustainability, and the undercurrent of all this is classic neoliberal thought. It's an impatience with governments. It's and the belief that these things are best done uh, through private organizations, right? And there's nothing inherently wrong with a focus on scale or cost effectiveness. The problem is when it distorts moral obligation. I'll just give you one example. This is classic utilitarian thinking that uh, if you have certain resources, then you should, for instance, maximize the number of patients you can cure. And the question is, who decided this framing of the problem? Why is this the right framing? Why do we only have X dollars? We always run out of money when it comes to the poor, and this has very practical consequences for what organizations do. I mean, the first thing you do is you sort of shift the burden to patients, right? So you can't go to their houses anymore. You ask them to come somewhere. It creates a whole lot of other problems for patients. You cut your field staff. You sort of centralize operations. You stay out of the most vulnerable areas because patients are hard to reach there. And you have no recourse for sort of the more complicated cases. You are now uh, uh, and so the problem is not with scale. The problem is how utilitarian thinking distorts the work that you set out to do, right? uh, and the only thing I'll say about resource constraints is that it's impossible to answer the question of what is possible. You might think that establishing a lab in the middle of nowhere is not possible, but it's just a matter of money, right? It's political choices that set budgets. And a lot of the work we did was, we were told it's not possible, but, a few years later, 5-10 years later, it's acknowledged as possible. So, uh, this is a canard, right? The resource constraints, yes, there are constraints, but there's also a lot of justificatory myths. Uh, and I think this picture will tell you what the role of technology and innovation can be. These are instruments. They cannot tell you what the world ought to be. They don't tell you what the nature and the structures of injustice are. They're not sort of always they're not directed to those. They don't tell you what the moral constraints are. And so they are powerful instruments, but you have to get these other things right. They can't do anything without moral clarity, right? And so in sort of the 4-5 minutes I have remaining, uh, uh, let me go through what I believe is one path to justice. So justice is hard, because it is not win-win. You make demands of people, and you can make those demands through coercion, and then it just mutates and comes back, or there has to be a reckoning with the moral costs of one's advantage, right? And for that reckoning to happen, uh, you know, uh, you need moral clarity and you need moral authority. And sort of one tangible way to work for justice is accompaniment, which means you journey with the wrong till justice is done. And if injustice requires othering, then accompaniment literally to walk with those who have been wronged and to see them and to stay with them till they are able to access, fairly um, what is needed, uh, uh, then that is a reclaiming of the other. So it's the opposite, of injustice, and it is justice made tangible. So the promise we make to everyone that we work with in our maternal and newborn health program is that, well, uh, the one thing we promise them is that we will be by their side from the time that they call in to tell us they're pregnant to 6 weeks after uh, birth, because that's sort of the most dangerous period. And every night, and I think tonight, someone at Innovators in Health will uh, sleep away from their family in a room next to the hospital to respond to, children arrive any time of the day, to respond to a call, will make sure that the woman gets to the hospital in time. If we need an operative facility, to make sure that she gets to an operative facility, and to get to a neonatal ICU if that's what's required. If that means we can only do 10 women a year, then it means we will do 10 women a year. We do, I think at our peak, we did 1,200 deliveries a year, and we can do more. Uh, but, uh, and the resources you have at your disposal go up and down, but here's a promise you can always make. And that's a promise of accompaniment, of never, ever leaving a patient alone in their journey, right? Uh, and this is what accompaniment looks like. This is accompaniment made tangible, right? These are female healthcare workers who rise way before dawn, cook for their families, and then set out and give drugs. And some of them give drugs to, 20, 30 patients before they leave for work, right? And accompaniment works in practice because it gives you a granular understanding of what's broken, uh, and what breaks is very particular to a particular person in a particular circumstance. And it allows you, it's this wraparound approach that sort of guarantees or vastly improves the odds of your success. And you also model the right action for the whom I call the persuadable unjust. And so, when I sort of teach my students how to do the work of justice, the initial design is always simple. I mean, everyone can engage in the work of justice because anyone can accompany. It doesn't require a lot of money. It does require sacrifice. And so the initial design is always just the fact that as an advantaged person, you will accompany someone who has been wronged will change outcomes. It's as simple as that. And so my sort of advice, if I can call it that, is you want to start small, but be morally exemplary. And when you do that, you break these justificatory myths of what's possible, of how constrained you are or not. And of course, we deal with resource constraints. I've been doing this for 15 years now. But what you don't do is confuse what you ought to do with what you can do today. And that distinction is crucial. And I've seen that when you do the right thing, it might take 5 or 10 years, but the world does follow. You do see policies change. And because I'm talking at the center, I feel obligated to talk about self-realization. And I will just say, paraphrasing Baldwin, what we do and what we do not understand about justice and injustice is what we do not understand about ourselves. I mean, the project of justice is the project of fully affirming your own humanity, of realizing your own humanity so you can recognize it in others. And so hopefully I've given you a sense of what we ought to do, the constraints on our pursuit of justice, and a tiny bit about how injustice works. And I'm happy to take questions now. Thank you. Thank you for your time.
Thank you so much, Manish. Folks, if you have questions, put them in the chat and we'll try to get to it. Manish, one of the things I'm curious to ask, because it was quite an arc in your own thing, from winning with this team. I see some of the team members here that I haven't seen in 15 years, from winning the Yunus Challenge. And at that time, the focus, like most of the projects at MIT, was around technological interventions and how it can shape things. We did not discuss moral framing. We had, some information about community engagement. But the work, it chose was not as attractive as working in HIV or cancer. It was a poor person's disease. The region you chose to work was the most sort of, downtrodden region in India. What kept you motivated? What kept you going?
I think it is accompaniment, right? This work, when you sit down with patients day after day, when you stand with them in OPDs, when you accompany them, I think everyone, who does this work will tell you that it's really that. And so when now I'm at a distance and not there, I think that's the hardest part about doing this work.
I think one of the things that is intriguing, I think overall, is oftentimes when we talk about moral purpose, we kind of simply associate it with a sense of meaning making, or that meaning making that leads to a sense of joy or fulfillment in life. But one of the important elements of moral purpose that we often don't pay enough attention is that moral purpose is also what carries us through tragedy and crisis. And that's something that oftentimes we sort of overlook. And the last 2 years of pandemic, I think, has given us sort of some framing around this. We have one question from Kush. Manish, couldn't someone argue that showing your compassion is also utilitarian because it is meant to increase adoption in the community, which is a utility on its own?
Yes, so I think you can frame a metric or a utility function around essentially everything, right? And as engineers, we do that. The question is, how do you illuminate concepts and frame concepts in a way that allows you to make demands of people? Because justice is not win-win. It's about making demands of folks. And utilitarian arguments, you can cast anything as a utilitarian argument. Everyone knows what the right thing to do is, but you need this, what Kant calls sort of a ingress to someone's morality. And that's why I think, yes, you can frame many things with an objective function, but that doesn't allow you to, for instance, flesh out the full moral costs or get folks to see advantage in a moral way.
Yeah, I also think that the statement is kind of a bit misleading because it depends on what community do you want to be part of. Oftentimes, in works of social justice and humanitarian enterprise, actually, most of such leaders get outcasted from their own community because they are trying to sort of help, somebody who's not part of their community and so on. And even in religious settings, it's a huge issue. Mother Teresa wasn't an honorable Christian when she started working with lepers in Calcutta and areas. I mean, she gained adoption in Christian community mostly after she got the Nobel Prize. Prior to that, there was no acknowledgement of her work, and she was sort of an outcast. And even in other religious communities, one follows or one sees these kinds of discrepancies arise. We have 2 minutes left, Manish. I think one of the questions I would have, and I'm hoping that these are the things that you'll be addressing in the IAP sessions. Most people, and I say most, I give benefit of doubt. Most people who come to study at MIT or any sort of institution of higher education, oftentimes come with this idea of making the world better. Come with the idea that perhaps they'll make the world better with whatever it is that they're studying or the contributions that they make. But there is a whole range of virtue signaling and false storytelling that occurs that is sort of quite prominent in our society. What would you suggest to such individuals in terms of having a more kind of realistic understanding of how they're framing the problem, because they're all seeking solutions. And oftentimes what happens is, we seek solutions only to problems that we know. Oftentimes you forget to formulate the problem. That's one of the things I think your group recognized early on, that the answer was not just cell phones and an electronic pillbox. It was connecting with the community and so on. But it took, 3 to 4 years to get to that lesson. What could you or others who are working in a community like MIT do so that when people are designing solutions or proposing solutions, have this know-how prior to their engagements?
That's a great question. And as Acquaintance says, moral clarity, moral transcendence peaks in high school, and then it's so I think there are two parts to that. One, we don't expect moral philosophers to design space missions, but we do expect people with no training in matters of justice and injustice to pursue justice, right? And so I think training is a big part of it. I think for colleges, I don't think colleges understand their mission as promoting justice, and we know that most elite colleges actually exacerbate social inequities. It's really the public universities that. So I think first we have to admit institutionally that yes, we want to be excellent, but we want to keep asking to what end, and we need to see our end as making the world more just. So I think that has to happen. We need to train people in matters of justice and injustice. I don't know why we expect that this is somehow innate. We need to move away from instrumental understanding of this work. Instruments are one part, right? But as an engineer, I see everything as a constraint optimization problem, and that's a very, I would even say, sort of a dangerous point of view in this work. So I think we need to move away from that. And finally, we need to desegregate. I think we need to have encounters with all those people we make demands of, but who are invisible today. You cannot, if you have not sat down with the custodian, if you have not sat down with those who pick your fruit, if you do not sit down with those who build our houses, you have this over intellectualized, some theoretical notion of what these other lives are. You understand the poor as a quote unquote a group. So these encounters, right, are the antidote to a lot of, I think you are almost guaranteed to discover the right way if you have these encounters. We need to get custodians to our departmental parties again, and we need to begin desegregating not just by race but also by class. And I think so all those things combined, I think, will equip us better. Yeah.
Thanks so much, Manish, again, and thank you everyone for joining us this morning or evening, depending on where you are. And stay in touch through our newsletter at the Dalai Lama Center, and we will be at some point uploading the videos of the Fall Reimagined series and notify you of it. And hope to see you more in the coming year with similar sort of programs. Manish, thanks so much again. And,
Thank you. Thank you, everyone. Thank you all.
Take care. Bye-bye.